So we've just encountered our first HMS model. Um, and for some of you, I'm sure it was a buzzing, blooming confusion, to quote William James. And I'd like to step back and situate it more broadly um, in a somewhat more structured way uh, within the broader context of scientific exploration and challenges within the health and healthcare sphere. Um, and I've given variants of this presentation dozens. Maybe now it's close to 100 times, but I thought we could do well to use a slightly condensed version of this that emphasizes the broader context of these methods, both as it relates to modeling and as it relates to simulation using that model. So to do that, I'm going to switch to some slides. I have slightly updated during the break some of the slides which I had previously posted, but it's very minor modifications in terms of, or very localized modifications in terms of just tweaking it slightly. So I think really the substance of it is just one additional slide. So I'll see if I can post these shortly. So I situate agent-based modeling very firmly within the broader context of dynamic simulation methods. And indeed, I simulate those broader yet within the larger enterprise of what is known variously as system science or complexity science. This is a scientific tradition which became particularly prominent in the midst of the 20th century that relates to, I kind of call it the science of the whole, WHOLE, as compared to the science of taking things apart into their pieces. So we've just seen a very specific example of a system science tool, system science model articulated with one system science approach, HM-based modeling. But I'd like to focus on the needs, talk about this broader enterprise of system science more generally, talk about dynamic models, again, more generally, recognizing that ABMs are, in my mind, close cousins in spirit, and they're essentials to other dynamic modeling traditions, dynamic simulation modeling traditions. And then I want to talk a little bit about this issue of models and data, which I only gestured at in my comments briefly. So, I'm motivated for a lot of this work by the fact that we as a society and indeed as a world are facing ever more complex challenges in the health and health policy and indeed healthcare and community safety and well-being space. And I put down some of those that stand out in our mind, whether it's syndemics of interacting conditions, Hep C and HIV, or HIV and Zika, or multiple types of STIs and their interactions with each other, but also long-term chronic diseases, things like diabetes with TB, for example. We see profound stresses in terms of or disparities in terms of mental health, and you know really um, uh, really quite sobering impacts of early life exposures, adverse childhood experiences, trauma in the earliest years on life course outcomes. Um, and uh, we have multifactorial complications, health disparities that tug at the conscience, and a healthcare system that's rather a disease care system uh, that often seems to have pieces that the left hand doesn't know what the right hand's doing, and their work sometimes even work at cross purposes, much less on a cross sectoral basis. And we could go on and on about this, but what really unites those challenges, and indeed the foremost challenges we face as a society and a world, many of them is the fact that they are complex problems, not in a rough sense of just meaning complicated. No, it's much more than that. They're technically, at a technical level, complex. They deal with phenomena where the whole is greater than the sum of the parts, just like we can't reduce a traffic jam. A traffic jam is not reducible to, cannot be simply characterized directly from knowing information about axle sizes and wheel types and chassis dimensions of the cars in it. It's at a different level. We can know all the world about those cars and their makes and their designs and their engine types and cylinders and the tires on them, and know not a bit about why traffic jams form, what can reduce traffic jams. So it is with complex systems. We're dealing with phenomena that are at a different level than the pieces. And this is a general characteristic of dynamically complex systems. The behavior of the whole, its resistance to change, can be surprisingly distinct from that of its pieces. And within these systems, if you poke in one place, often the effects are felt across the system because of the coupling. They're often delayed in time, so it's hard to judge if you've had the impact that you're seeking. They're distal, they impact things way down. So the change in prescribing practices in a doctor's office for chronic pain can end up rippling through to presentations in the emergency room years later for opioid poisoning, right? Or demands on treatment centers, or number, the challenges of dealing with chronically homeless people within our shelter population. And often we have reciprocal causality. It's not just A causes B, but B causes A, right? And it's not just that loss of a job fosters poverty, but poverty will often lock people in a way it's harder to get a job. Lack of access to transportation, lack of an address for those struggling with shelter issues, etc. These systems, moreover, react pervasively and surprisingly to interventions. We saw that in our little model. Maybe some of you were surprised. I know I was by, if we undertook changes to, closing schools, why it seemed to raise the number of people getting infected at workplaces, for example. Systems behave in surprising ways. When you try to deal with any of these types of conditions, and many more, conditions of antibiotic resistance are also there, you often get surprised. And this is not merely a curiosity. It's not merely a quaint, intellectually curious aspect of this situation. It matters because it frustrates us in our ability to design effective solutions, fixes that, to use Jeff McDonald's words, that stay fixed. Um, and this feature of complex systems, these sort of um, frustrating characteristics or perplexing aspects of it emerge from a variety of underlying features of these systems. If you look at complex systems across these different areas and many more, many lying at the heart of our global challenges, whether it's with climate change or disinformation and misinformation, or politically induced violence, or radicalization, or misogyny. Many of the features that make systems complex feature certain hallmarks, feedbacks, nonlinearities. And nonlinearities is a very specific term here. It's not just meaning one thing doesn't occur always after the other. You can get effects that are nonlinear in a technical sense in a way that frustrates our ability to describe the system as the sum of its pieces. Nonlinearity at a mathematical level means we can take the effects of it and parcel it out into its pieces. And as much as people aspire to do variants of that with like associational studies, in general, it can't be done. It's not just a matter of, it's either A's or it's either B's. There's these complex interaction terms. And, they're whispered to and when associational models and needing interaction terms, but it's much more complex. There's network structures, there's learning effects, there's localized effects, there's pronounced effects of delays that make understanding the effects of an intervention hard to assess. And sometimes means an intervention is declared ineffective before it's even had natural time to take effect. Now, these effects or these features which underlie these systems, and I could list others here too, they induce effects on the system. These give rise to the nonlinearity, the feedbacks, et cetera. They give rise to emergent behavior, to this behavior that cannot be traced down to any one piece of the system, just as if, the behavior of a traffic jam can't be traced down to any one vehicle or any one aspect of the situation with the current precipitation or purely the visibility or what have you. Yes, it involves all of those, but it's a complex interaction of all of those and typically nonlinear. There's this cross-coupling, changes in one place and another. There are tipping points that the system can exhibit markedly different behavior. Say, if you have that certain herd immunity in a way that's conscious, that takes into account local variability, you can have a situation where you achieve measles elimination, and then a situation by contrast where those vaccination rates have plummeted and where you get resurgence of measles or pertussis. We know this all too well, across multiple countries now. You can get lock-in effects, which trap someone in a cycle of poverty, for example. Lock-in is a feature of complex systems, which means that and one of its implications is that generally it's vastly easier to prevent, say, someone from getting trapped in a cycle of addiction. If you can prevent it, you can do so with less resources than trying to get them out of it, pick up the bag after the fact. Same thing with poverty or exposure to trauma. Dealing with it after the fact is much, much harder than the effect of being able to uh, avoid it. The benefits of avoiding it are vastly more easily delivered than in dealing with it after the fact. And there's many other features here, including effects of heterogeneity that play a big role in agent-based modeling of networks, etc. So I'd referred to traffic jams before, but the landscape of health issues and community safety issues and healthcare issues are replete with phenomena that are emergent. In fact, I referred to several of those, but some of those biggest challenges, like the emergence of antibiotic resistance, despite successive generations of frontline antibiotics, etc., are testimonial to this, and we see it across many of these different health spheres. Emergent phenomena are not, of course, limited to the health sphere. We see them in ecosystems and the natural rhythm of population cycles noted at the Hudson Bay Company with, lynx and hares in Canada's north. We see, historically in the pre-vaccination era, oscillations in childhood infectious diseases, etc. And these, again, are not merely matters of intellectual curiosity. They really have to do with our ability to how we go about understanding these systems and how we go about trying to bend the curve, how we go about trying to turn things to the better. Just as we can understand a species well, but not the ecosystem, or understand the cars in a traffic jam really well, but not the traffic jam itself. Understand the effectiveness of a drug as measured by a clinical trial, or if its efficacy can have limited bearing on its empirical effectiveness, because the very things controlled for by the RCT, whether it's dropout effects or effects of one person sharing the results or their side effects or the use of the actual substance with others, etc. These things end up affecting what's measured from an RCT. RCTs have this constriction to look only at people with a single condition. That means that the very interactions we see in the population are that can be so important are excluded from their lens. And that's not to say they're not useless. They're extraordinarily helpful, but they exclude many systems effects that often have profound bearing on the outcomes that are in fact realized in the population. And I could go on here, but I don't think we have either the time or the need to go into an exhaustive look at how pervasive these effects are, how ubiquitous they are. I do want to emphasize, though, that these effects can be systematically applied across many different areas. Whether it's the food system, we can find feedbacks, delays, disproportionate effects of heterogeneity, lock-in effects there. And some have sought to, like Sandra Galea, have sought to map out aspects of this food system that bring home its structural complexity. But what's really of note here is its induced dynamic complexity. Same thing with emergency department waits, lock-in effects, feedbacks, bottlenecks, systemic imbalances, heterogeneity, etc. Opioid epidemic, many of the same fundamental hallmarks of complex systems, and indeed, tragically, many of the same induced properties of adverse outcomes. We could look also, we need look no further than antimicrobial resistance. Now, these systems exhibit emergent behavior is not entirely a new observation. This from observations of the bubonic plague in the early 1700s, which noted the characteristic infection curve that we saw, in fact, reproduced in our little stylized model there, involving population movement within communities. We see them, writ large in the number of measles cases seen in Alberta or in Texas, or in the numbers that we saw playing out during COVID-19 in New York City here in the early months of the COVID-19 pandemic, where here we saw information in yellow on number hospitalized. Here, this rising curve here associated with test volumes, for example. The brown here, number of new cases, test positivity shown here in orange. And we see a characteristic infection curve induced indirectly in hospitalization. We see that historically, as I mentioned, for childhood infectious diseases, but in many different areas, including network context of clustering of individuals who are working with obesity challenges, clustering in social networks. And we see it writ large in the areas of health disparities for areas of LA, with some collaborators we work with there on the food environment. Now, one of the challenges that most motivates the use of system science approaches here, or one of the aspects of historic context that induces need for system science methods, is the fact that traditionally, for over centuries, really, much of science disproportionately emphasized reductionist approaches. When I talk about reductionist approaches, I'm talking about understanding systems from watches to the anatomy of animals, of people and other mammals or reptiles, to matters of understanding mechanical systems of all sorts, geological elements, by taking them apart into their pieces. And this has been a very fruitful enterprise, and yet led to profound insights. You can see gears that are juxtaposed on one another within a watch, or understand how car pistons work by taking it apart. But you can understand how pieces of the anatomy articulate with one another, the valves of the heart, or how different, the bile organ links up to the bile ducts come from the gallbladder. But as we know, this strategy has its limits in understanding why we see the induced behavior, whether it's of the glucose insulin system or issues having to do with imbalances leading to kidney function at a physiological level, or whether it's matters having to do with the problems that a vehicle is having, or indeed the challenges that individuals are struggling with when dealing with shelter issues. The pieces can be understood well, but we can often have very little insight into why the behavior is induced from those pieces in isolation. We could take a watch and put all its pieces on the, array them out on a table but not still understand the essence of why it ticks, of how it works effectively. To understand that, we need to understand their interactions, not each gear in isolation, but how one drives the other, how they relate to one another, how they relate to the regulator arm, etc. We need to understand interactions, not simply the pieces. And taking things apart into pieces often doesn't give us that next step as to how do the pieces work together to give the behavior. We saw this in a quite striking way in the Human Genome Project. There was tremendous amounts of expectation and enthusiasm that by sequencing the first human genome, and indeed subsequent human genomes, that we would transform the ability to treat diseases. And to be clear, it's offered many benefits. But what it's not done is offered us an immediate understanding of the mechanisms by which the information encoded within that genome is regulated, expressed under different environmental conditions, gene by environment interaction, and which parts of it are upregulated or dysregulated at certain times. Requiring that requires much more intensive understanding of the emergent properties of it. Indeed, has given rise in significant part to the field of systems biology, which is an aspect of system science applied to biology. So this strategy of taking things apart into pieces has given us profound insights, but isn't the whole story any more than you build a house purely with specialists, plumber, electrician, roofer, concrete specialist. You need someone who puts the pieces together, a general contractor, a construction manager, perhaps it's yourself, to make sure these all work together, all interact in ways that yields in ways that are compatible and yields a complete whole. Because a traffic jam is not merely the cars within it, we need to understand how these pieces affect the whole. And making decisions absent that understanding of how the whole depends on the pieces, on the interactions between pieces, is risky. Realizations of this go back millennia, and I'm reminded of the parable of the blind man and the elephant, where it was posited we have these individuals each grabbing different portions of an elephant and claiming that they know the true shape of the elephant, the true features of the elephant. They're each grabbing the piece. But if you want to stop the elephant from rampaging crops, or you want to help stop plummeting numbers in the elephant population due to its due to habitat loss, or due to the impacts of poaching, you need to do more than understand those pieces in isolation. You need to understand how they interact with the elephant as a whole, and aspects of the behavior of the elephant comes from interactions of different elephants. And all too often in our work, we're a little bit like the blind man and the elephant. We know one piece of a system and not others. And all too often within the current context, the contemporary context, if I could sharpen that point, people go to analyze one data set separate from another. They try to tease out the features of the hospitalized population here, perhaps, in isolation from the numbers about testing, or the numbers of new cases, or the rate of positivity. And I would argue that these are not solitudes, that the number of new cases over time in brown here is not something to be considered in a siloed way, in an isolated way from the number of new tests, nor from the test positivity. They are all linked, but they are linked in complex ways, right? The number of tests, a larger number of tests might yield to discovery of new cases, right? But discovery of new cases might motivate, particularly in the context of contact tracing, for example, new testing. These two are interlinked. I would argue that they are per forte interlinked with the test positivity here. And they are far from independent. They are very linked in another way, the number of new cases with the number of hospitalized individuals. So if we're to understand the world, we're to grapple with data we have from the world, it's of critical importance for our effectiveness that we avoid dealing with the pieces in isolation from one another. And I will note that all too often this is the tradition right now of taking up a data set in isolation and analyzing it on its own, which can offer some value, can offer on some insights. I don't dispute that. But often what makes it much more valuable, what often makes it more actionable for use, is if we understand it in its context, in its interaction with other phenomena and with other, for example, observed data. Those are whispering of the situation with the broader elephant. And we do well to consider them together. So if we want to explain, from phenomena like this, what's going on in the world, if we want to have a consistent understanding of the underlying epidemiology of COVID-19, in its pieces and in its different manifestations, hospitalized cases, new cases, amounts of testing, contact tracing effectiveness, etc. We need something more than analyzing each piece in isolation, moving beyond them as solitudes and considering their interactions with each other just as much as if we wish to explain a traffic jam. We have to go beyond considering each car in isolation. We have to consider their interactions, the visibility, the braking patterns of one and how it induces braking patterns of another, the extra space afforded when the road is slick in a snowstorm or what have you. So if you want to understand from the world, what's going on, is the situation improving with the number of cases going down? Is the number of cases here, is it being rising? Is that a terrible sign? It's an emerging crisis because we're getting more and more cases of people who are positive COVID, or is it a sign that our testing is being more effective? If we see a sudden rise in gonorrhea cases, is it because we're doing better at overcoming stigma and drawing people in for testing and partner-assisted therapy, or is it because we are seeing the beginnings of a giant outbreak occurring that's largely independent of our testing? So if you want to understand the situation in the world, does the evidence in the world support a hypothesis that an outbreak is coming under control? Is this situation likely to worsen next or get better? What's driving these patterns? Is it predominantly a matter of testing that these number of new cases arise? Is that a bad or a good indication? Traditionally, we've had a really major challenge in front of us. If we are relying on informal reasoning, the reasoning in our head, the discussion among various experts, each of them may have a theory in their head about what's going on in the world. And they're trying to figure out, does this data bear out their theory? it's their understanding of what's going on in the world that basically this is largely driven by community spread, that the testing is following that, and the number of hospitalizations is driven by the severity of the cases being found, etc. If they want to test that theory, they've got to reason it through in their head, and that's a big challenge to do that effectively. But we're trying to do that in a way that cross-checks our theory, that learns from empirical observations. And doing that is hard because trying to figure out what our theory implies in terms of what we think we should see if our theory holds on the testing side or on the hospitalization side, it's hard to do in our heads alone. It's challenging. The situation is compounded. It's much worse if we need to intervene. We want to find where to best intervene, how to intervene, at what point in the system, at the testing level, mass testing, at contact tracing, in terms of testing all contacts, for example, of all cases that are identified, about testing contacts of contacts. To what degree we focus on for vaccine-mediated infections, vaccine distribution, with outbreak response immunization campaigns versus mass vaccination campaigns, campaigns in schools for HPV versus in the community versus, and compared with screening efforts for HPV via pap smears or with HPV-based methods more recently. How much should we intervene and invest in one type of intervention or another? How soon should I see effects? If my contact tracing is having effects, should I see a rapid increase, but then a rapid decrease in the number of new cases, or is it going to play out over a longer time? How do I scale up my intervention? If it's working in Saskatoon, how do I bring it to Edmonton? Or how do I bring in a strategy that's working for Edmonton, like the ARCH program, to something like Saskatoon, or bring it to Moose Jaw? How to make this implementation financially sustainable so that the money saved can be invested in other purposes. So these are big challenges, and they're challenges where being able to reason about them in our heads is especially difficult. I want to highlight that these are real world choices for a lot of systems, whether it's the food system, dealing with challenges of polydrug use, challenges of homelessness and those challenged by shelter, whether it's challenges associated with the spread of antibiotic resistance, or emergency room waiting times. All these share these complexities. And, here, the challenges we talked about earlier in understanding the system and reasoning it through from our head are multiplied. Because we not only each have theories in our head about what's going on, but we want to start in interpreting the degree to which the observed behavior is consistent with them. Here we have to reason about how would interventions affect what's going on in the world? How would people's behavior change? How many people will be found through this new type of screening? How many people would accept vaccination in schools for HPV rather than as an adult, etc.? And we're trying to get to certain desired outcomes, but relying on informal reasoning to put these things together to say which interventions would have biggest effect. How soon would they have effect? On which groups? Would it be equitable? This is really a fundamental challenge. And the consequences of this are writ large in terms of the deleterious impacts on our health, our population health, and the workings of our healthcare system, and indeed cross-sectoral coordination as it comes to community safety and well-being issues like overdose prevention or suicide prevention, or matters having to do with intimate partner violence and gender-based violence, domestic violence more generally. So these challenges of understanding, reasoning about interventions, about understanding what's going on in the world, they have consequences that are grievous in many cases, misperceptions of the situation. Again, declaring an intervention dead before it has effect. Maybe a life course intervention that is deemed too expensive and not yielding good enough results within 5 years, whereas realistically you can't yield the results in fewer than 20. Unanticipated responses to interventions or policies where we're knocked on the head by unexpected results, right? And these gaps in our understanding and our understanding of what's going on really undercut our ability to coordinate across systems, for one part of a system to work effectively with another. Often there's dim understanding about the dependencies there. They undercut our ability to learn from experience, to design a better system, and ultimately, by extension, to policy resistance, cases where our interventions are diluted or defeated by the nature of the system. And even if we invest heavily in a system, if it's not done in a judicious way, if it's done in an imbalanced way, for example, in this picture, we end up going around in circles, right? As a system. If we may invest very strongly, but if it's in the parts that are not the bottleneck, we end up getting very little gain from the results. So the bottlenecks may be in the community for getting people out of the hospital. We make the mistake for thinking long emergency waits are a reflection of the problem in the emergency room, and we up the number of physicians present, the number of nurses present, and we expand it to have a larger emergency capacity to welcome patients. But we don't realize that it's a reflection of a bottleneck that extends throughout the hospital in a traffic jam of sorts, because people can't get discharged in time to the community because the community services aren't there. Long-term care facilities are not near their families. They're not going to be able to sustainably live in their homes without the community support from home care, or the provision of transportation so they can make their way around the community in a way that reflects their new weakened condition. So the emergency room may be where the problem appears, but if we just invest in the emergency room, we're not dealing with the bottleneck. We're not dealing with where the problem is actually located. And we end up pouring money into certain parts where it's not needed as much and starving the parts where it's needed, the community care. This is a real world context. It's a systems problem. And so it's not just we're not spending enough money. We're not spending money judiciously. And we're not spending it in a way that gets bang for the buck in a conscious way, in a way that that understands the nature of the system. And all too often we're like King Canute, ordering back the tide, working against the nature of things, the order of things, where in reality we have to work with the nature of things, understand that reality, understand those couplings, understand the linkages, understand the relationships between the pieces, so that when we act more effectively. We act in ways that will yield greatest effect. You may remember in that model we saw, not an hour thence, we were testing different strategies, intervening by closing schools, intervening by closing work, reducing community community going. And what we found is that some of them yielded less effect than others. Some lowered it from 75 to 71% peak prevalence or something. Others lowered it to something like 34%. They had different effects. We need to understand the nature of things to not be batting our head against the wall, to not be working against that nature. And for this purpose, we turn, scientists and indeed practitioners these days have increasingly turned to system sciences, science of the whole. Now, a fundamental feature, a defining feature of this approach, whether it's in simulation or modeling, is reasoning about the processes that shape the world. Not merely about the indications we have, not merely about the measured data that we happen to get from one piece of the system or another. That has value, but the most important thing is to think about the driving factors within the system, the underlying mechanisms that lead to it. Some of you may be familiar with the work of Pawson and Tilley in realist evaluation and critical realism. And if anyone's interested in the broader philosophy here, I would refer you to work by Bhaskar and others on critical realism. This idea that there are phenomena out there in the world. We see whispers of these phenomena through data we receive from the world, but what fundamentally shapes our effectiveness is the underlying mechanisms. Realist approaches emphasize context, mechanism, outcome. So do simulation models. It's the same triad here. And indeed, we saw that writ large in that particular model we were looking at. The context, people in the context of a community with different types of physical resources and so on. The mechanisms by which one person could transmit to the other, or by which one person decided whether to go into the community after work or go home directly. Same thing in school. The age specific governing of whether someone went to work or school. And the outcomes. We saw those outcomes up at the top. But those outcomes were not the process. They were whispers of the process. They were reflections, summaries of the process. Our focus here is on the underlying processes, the underlying mechanisms of causal effect of one thing to another that interconnect factors. And the idea here is that these sort of patterns we see are all different facets of, are all different faces of, all different whispers from some underlying process. I'm hoping the TAs could admit folks when they appear. So in the enterprise of system science, our focus is on understanding this underlying system that gives rise to these patterns we see, not being taken by assuming that the patterns we see from the world, the empirical data, are the world. No. It's what gives rise to them and what unites them, right? I argue these are not solitudes. These are different facets of a common underlying picture. And in fact, that's what we often reason about our heads when choosing interventions, right? And system science is about that underlying picture. To interpret and understand why these patterns persist, why we see certain changes over time, and to understand why they may resist impacts to correct them or to change them or to bend that curve. We need to reason about these mechanisms. Otherwise, we risk working at cross purposes, like poor King Canute, misadvised by his flattering advisors, just like a certain, well, enough said. There's agency on both sides. So with system science, complexity science, as science as a whole, um, um, it's an intellectual edifice that's designed to help us visualize, understand, reason about, and intervene about the implications of understanding the underlying system. And it can help us test consistency with evidence from the world, the degree to which our theory holds water, right? We saw that earlier with that model that we were working with, right? It produced this pattern of infection prevalence over time, or cumulative number of cases, or posited where infections were taking place in the population, et cetera. And that's good, because not because it's the truth. It's good because it helps us ask, is that really consistent with what we see? Helps us go to experts, helps us go, in some cases, to people with lived experience and ask, does this jibe with your experience? So we're trying to move here in a more profound direction than is traditionally the enterprise of more traditional statistics and machine learning, where we're dealing with the empirical data from the world. It's not that we deny the value of them, but we don't get caught up in those observations as the truth, any more so than we want to be like Plato's captives in the cave, these trapped prisoners who mistook the shadows cast on the wall as the real situation in the world. We don't want to treat, this data set as a solitude that needs to be considered and valued in isolation, nor this data set and the number of cases considered purely in isolation. We want to understand the underlying reality that's driving all of them, that's giving rise to them collectively. We want to be like the freed prisoners who break out of Plato's cave and deal with the underlying situation in the world, rather than simply the shadows cast by the empirical data we happen to have given to us in the world, we happen to collect within that world. So system science, complexity science is about breaking out of the cave. It's about reasoning about the science as a whole. And a central value delivery mechanism here, a central construct of value here, central enabler, is dynamic models. Why? Because they weave together representations of our hypothesis about what's going on in the world so that we can test it, so we can challenge it, so we can critique it, so we can share it, so we can refine it, we can improve it collectively. As to how these different factors might interact. So folks, dynamic models like this one we saw before, I held forth to you, can be viewed as operationalized dynamic hypotheses. They're enacted hypotheses. We have a hypothesis concerning the underlying system structure, and we know it's not perfect, but it's by undertaking it and investigating it and seeing the results that we learn and improve it. Just like a scientist, learns by staking out some hypothesis. They know it's probably an oversimplification, but by undertaking it, you can evaluate it, test it, falsify it, clarify your understanding, and move forward. Francis Bacon, the famous philosopher, 1600s, once said, "One sooner secures truth through error than through confusion." And that seems like an outre comment, a comment of profound chutzpah. But these days we might say a fail early, fail often, right? It's by trying some approach that we learn where that approach falls flat and we can improve it. Sitting back and sort of saying, well, I don't know what the situation is, I don't know what the complete model is not going to get you in. And it's not going to clarify your thinking in a way that trying something, learning from it, where it falls flat, and improving it will advance your understanding. One sooner secures truth through error than from confusion. Fail early, fail often, fail forward. Take some stance and learn from it. Have the authenticity of trying it so that we can improve our understanding. And much of the challenge here, traditionally, that motivates that is that our working hypotheses are stored as mental models. Far from being explicit constructs which we can show to someone else and have them challenge us, to have them tell us, no, you need a long latent period, or you need to represent waning of immunity, or you need both asymptomatic and symptomatic infectives, or you need to capture that for some people they will not engage in recovery except through treatment. All those are really useful, and we can improve a model based on those. By showing it to them, we can get that feedback. If it's in our head, we cannot do that effectively, right? It's trapped. Others cannot see our understanding, cannot challenge our understanding, cannot refine our understanding, cannot build on our understanding. So simply having a model articulated and shared in a transparent form, even if I couldn't simulate this, even just depicting it, making clear my assumptions, making clear what I'm positing, my hypotheses, it's a contribution. It invites critiques, supports sharing of ideas, lets us build on our ideas, refine them. Collectively, it lets us improve our understanding. And allows comparison with other people's ideas, right? So sketching things out is valuable. Now, we can sketch things out in a less formal way, in ways that are still useful, like this from my colleague Sandra Galea, depicting the relationship of factors. These are all, good things for trying to situate us and understand at a broad level how, certain factors having to do with food security might relate to certain economic factors or environmental factors. All this is good. But when we sharpen that for forms of linkage that have clear mathematical structure to them, and I mean this, that have very well-defined meaning about what an arrow means, how to interpret it. In this case, how to interpret a plus polarity versus a minus one. And going from A to B compared to B to A, or both, reciprocal. If we have crisp characterization, precise characterization, I'm not going to go into this now for lack of time, we can get a lot more out of it yet. And we can reason, in fact, about induced behavior and indeed emergent behavior of sorts. So we can reason, for example, about not only the polarity of a link, but the induced polarity through composition of a whole feedback loop. We can reason about feedback loops of different sorts and how they might compete. And even for something like this, we can reason something about the archetypical behaviors induced. It's one of the powerful things about causal loop diagrams or other diagrams with clear mathematical underpinnings. Not to say that a diagram with, notional suggestive lines, it doesn't offer some value, but we can get more clarity, we can get more crisp understanding and more emergent understanding with diagrams of this sort. And when we put two diagrams together, you can get emergent new links linking the two diagrams. If we sharpen those things further, such as by introducing a distinction between accumulations or stocks, shown here in rectangles, or flows, shown here as these double links, versus typically more or less short-term connections here, without long delays or accumulations. If we sharpen that further, we can get yet more insights. In this case, insights about imbalances, the impacts of imbalances between inflows and outflows that are profound, enabling, and that can open up avenues for important discussions with stakeholders, with community groups, and open up avenues for important insights for policy, in fact. Even without it being simulatable. This is not directly simulatable in its current form. This is not simulatable in its current form without formulas for all these things. This is what's called a system structure diagram. And I'm not showing a full socket flow diagram with formulas. And we can do the same with the constructs we'll be using. You may remember these from our little model, these so-called state charts. These have well-defined mathematics associated with them, and they can be used to engage in discussion about our assumptions when it comes to things like someone's using status for substances, for say narcotics, or their interactions with the healthcare system, or their willingness to change. So this is kind of the related to the trans-theoretical model, an adaptation of that, or their management of prescription opioids for chronic pain, for example, or post-operative use. And tools like this can be very useful for participatory modeling. And Peter Hoffman's work, in recent years, our own work with Jenna Meath, that some of you know, makes use of these to very good effects. And we work to ensure that the underlying software will best support that. But what we've been dealing with here are modeling. And modeling offers profound value just by getting a shared representation that can be challenged, improved, critiqued, built on. But I want to highlight the extra value added by simulation. We saw that earlier. I mean, here we're laying out our assumptions, or in this case, very simplistic assumptions about people's movements in the community and their natural history of infection. This has a certain value, take it out of our head and sharing it with others. But what's more powerful yet is to build on that by making that specification, by describing this at a level precise enough, specific enough, unambiguous enough to allow us to simulate it over time, to ask, what are its consequences over time? What's the behavior induced? We saw that earlier, right? If I were to go run this, we see the behavior induced by this system. And that behavior induced by the system over time tells us more and opens avenues, I argued, from this very seat, avenues for critique by others, avenues for new insight as to where our model is off base or where it holds water. Models, they help us refine our model, but by extension, our mental model. Now, partly motivated by some of the questions from earlier, I'll just note that simulation models across traditions, discrete event simulation, system-dynamic simulation, Petri net simulation, nature-based modeling, microsimulation, These go by many names of many particular traditions. I just, you know, just commented on several of them. But these are all close cousins. And they're cousins that are diverse, like any set of cousins, but they are they share more than they have in differences. And they go collectively by various names. Mathematical model, a mechanistic model, sometimes causal model, although that gets quite confusing when talking about them in the context of causal models in the sense of Judea-Pearl and reasoning about causal inference. Even mechanistic model is somewhat overstated, and so is mathematical model. These are imperfect terms, but they generally can be, they're common terms to refer to this whole class of models. And all of these share agent-based modeling, stock and flow simulation modeling, Petri net simulation modeling, discrete event simulation modeling. All these share an interest in examining dynamic behavior resulting from hypothesized causal structure. Causal structure is different that we focus on, how we characterize that causal structure, the building blocks we use to describe situations in the world, and indeed the types of simulations in the world in which they focus are different. I'll discuss that later in the bootcamp. But they all share this fundamental goal of examining behavior over time resulting from this structure. Note my emphasis again on structure. It's not just data in, data out. To think that is to impoverish our understanding. It's a lot more than that. And the causal structure gives rise to emergent behavior again, which often serves as a very important way of grounding the model against empirical data. We tune the model to best match empirical data against its emergent behavior. But these models depict this hypothesized causal structure, the kind of physics of the system, as it were, as it's sometimes called, the underlying mechanics of it. All these are imperfect terms. The underlying cause-effect relationships. Posson and Tilly and critical realists, we talk about mechanisms underlying the generative mechanism. But all share the fact that, we're depicting an underlying dynamics where we have generally imperfect data, and we have very limited data. Sometimes we know very little about this system. So what we're depicting, to use terms common in statistics, would be a lot of latent state of the system. And indeed, there's a proud and in my mind, very well admired set of statistical methods, which we use quite a bit, which depict latent system structure, not just observables. And this is very aligned with that. But here, these simulation models depict the latent state of the mostly latent state. I mean, these underlying systems are only measured at a few places. Now, what these models do is simulate the step-by-step evolution of the state of the system over time, according to these posited rules. So here, these are posited causal relationships. We posit this as our connections. We think, okay, that's my going hypothesis for how people circulate in the community. I spend time at work or home. This provides a fairly nice articulation, I might think, to the broad patterns in people's circulation. And these are the germane stages of infection. And in order to simulate this, then what we're doing is we're simulating over time. I say step by step. I mean, it's occurring successively in time. In fact, here it's continuous time. You'll find many other agent-based modeling frameworks, commonly in R, also in the context of NetLogo or Repest, commonly occurring, in ticks, step by step. But the point is, you're simulating how the state of the system evolves over time as successive things happen. People are in these states, they're at these locations, they're changing over time to this one, they're exhibiting this behavior at home, they're in this infection state, certain agents have died, etc. So what we are simulating over time, and we're mimicking the underlying evolution of the system over time as we see it in the world, bit by bit by bit. How the different traditions show that: a stock and flow tradition, an agent-based modeling tradition with state charts and networks and situated spatial context, discrete event simulation. The building blocks by which they characterize the rules are different, but all of them are simulating over time this behavior as it plays out over time by simulating this state and its change over time. And for a nonlinear system, that is what we have to do. There's no shortcut. There's nothing that will just write down for a general nonlinear system the result. Because this captures causality, we posit explicitly here causally, just like a scientist would posit certain relationships. And because we are positing the model in terms of causal relationships, mechanisms, generative mechanisms, to use the word critical realism, we can use this to examine counterfactual situations. We can use it to examine what-if situations, which are different from all. Mark my words, this is extraordinarily important. And it marks this out as profoundly different from the enterprise of the vast majority of machine learning applications or statistical applications. I'll comment more on this later, just like I'll comment more on theory later time in a bootcamp. But here it's really important to note that if you hinge your model on training it against past data, as is the norm for statistics or for machine learning, as most commonly applied, your model is contingent on those patterns in the data generating process, to use a term as it's commonly used in statistics, staying the same. As long as your emergent behavior is the same, your model will match the situation well. But if you change the situation, if you introduce a new vaccine, you introduce a new therapy, you introduce a health intervention, those patterns, those associations will be thrown off, grievously common. The patterns of people presenting, how many people present with different levels of severity of infection to the emergency room will likely be very, very different if you introduce widespread vaccination than if you don't. And with machine learning and statistical models, they're going to be generally contingent upon that data generating process remaining the same. Here, in simulation, because we are characterizing the posited causal structure, we are able to ask counterfactuals, what-if questions that are like going off-road, right? It's like machine learning and statistical models are a bit like driving, looking out your rearview mirror, as traditionally construed. You are missing. It's fine as long as you're going in the same data generating process. Here we're going off-road. Here we're able to ask what if questions that have never been observed before. Because we are positing the underlying structure of the system, we can get a decent guess as to what might happen. We can develop hypotheses about the underlying system that allow us to do a reasonable first understanding of what might the results be, because it's not contingent on matching all the data from the data generating process as it has been. So what are some uses of this model? Well, some of my colleagues, Dr. Burke, who is Dean of University of Pittsburgh, Josh Epstein during his time at Johns Hopkins, they've listed dozens of uses of simulation modeling. I'll just mention a few here. They capture our models of causality. They aid faster learning and more deeply from evidence by allowing us to challenge our understanding of what might be causing the system and test the degree to which our posited understanding, our hypothesis, is consistent with the evidence. Does it yield behavior consistent with the evidence when we enact it? They can help us in management of complex situations by allowing us to ask these what-if questions. We can look for interventions that are high leverage or robust to uncertainties or cost-effective. We can evaluate benefits of restructuring the system more radically, involving different balances between community care and acute care. We can better understand trends, better understand why we see that rising number of cases. Is it because of more effective contact tracing, more effective mass testing? It's because of broader spread, what have you, broader infection spread. We can challenge our data. Data, it might be said, might be and should be emphasized, doesn't come from heaven. Data often has limitations associated with, gaps associated with it, inconsistencies associated with it. And models are a formidable tool. I can offer testimonials from about half a dozen cases in my life that if you didn't have the model, you would never have realized the profound limitations of the data. The model brings to the fore, highlights that the data is inconsistent in some way. It helps you better understand the limitations of that data, better understand the hidden inconsistencies between data collected till time t and from t forward. And it can help us understand context which different strategies are best applied, how to translate from one context to another. And it can support cross-system, say across corrections and policing, to social services, to health and health care, public health and health care as it relates to homelessness or as it relates to substance use, across these different systems. So what models do here is they offload us from informally reasoning about the behaviors here. And they let us use a model to link these things up. Instead of reasoning in our head about our hypothesis in the world and asking, is it consistent with the empirical evidence? Does it give rise to behavior that is consistent with this evidence we see from the world? Is the evidence from the world consistent with my theory of what's going on? Instead of doing that, we can use a model to link these two, right? We can use a model to tell us what dynamics are implied by that model over time, what burden of infection we would see in terms of prevalence, in terms of cumulative incidence, in terms of number of infections per person, in terms of the where the infections are take place. And we can check that against evidence. But more than that, we can, with interventions, ask what-if questions. If we're just relying on informal reasoning, often we're shooting in the dark. We have this mental model that's very partial. We can't really reason through how that leads to implied behavior anyway. And now we're trying to reason about the effects of interventions. Just bound to get confused. Here, we can go and ask, we can take a model and systematically examine effects of interventions. We did that right here. Working from home. We simulate the effects of working from home, simulate the effects of schools being closed, simulate the effects of a lockdown where both are closed. And we can see the results as it is implied by our hypothesis. We're testing our hypothesis. We're not treating it as a given over time, but we have to ask, what's the alternative? So a dynamic model, I hope it's clear, it's increasingly clear, is far from a crystal ball. It's much more like a learning prosthesis. It's much more like a tool that, so if you think about it, a crutch or a cane or an artificial leg, artificial arm or hand, they let us approach something like full functionality despite a physical limitation, right? So we've broken our leg and we use a crutch to get around. We've broken our foot and we use a boot, right? One of those big boot structures. It helps us achieve something close to full functionality despite our limitation. That's what models do. But instead of being physical limitations they deal with, they are cognitive limitations. They help us achieve something close to full functionality despite our cognitive limitation. So they are thinking prostheses. They help us reason more consistently, reliably, and rigorously about the world. They help us think things through more thoroughly. They help us challenge our understanding by fail early, fail often. One sooner arrives at truth through error than from confusion. You take some attempt, you try something, and you learn from it and improve. And this allows us to put whatever empirical evidence we happen to have, recognizing that it's partial, to more complete use, better use, by challenging our assumptions, informing then, by extension, our choices once we have enough trust in the model, and advancing our understanding, advancing our mental model and our inner model. So here we're co-evolving. Our mental model and formal modeling artifacts with our simulated dynamics. And we're observing from the world, and hopefully in ways that are challenging our model. Maybe there are interventions being undertaken. We compared them to what the intervention yields it in the model to what we see from the world. Following that intervention, we refine the model. Over time, we see things play out in the world and we improve the model to better represent it. The model here is not some crystal ball that at any one time is correct or it deserves to be shattered. It's a living tool of learning. And I want to emphasize that while we'll talk a lot about models in this bootcamp, well, we'll build them together in some profusion. Generally, it's the value of the modeling process, not the models themselves, that offers the greatest value. It's the fact that we go through modeling rather than the model that yields the value for them. It's the process of reflecting what we know, what we don't know, what you think versus what I think is going on. How are we to interpret this new data coming in from the world? How to interpret this data anomaly? Is this data reliable? What do we think is happening with behavior in the area of contact, of mixing between people, or in the behavior of people's circulation in the community? Do we think people are still abiding by the work from home orders? These things are brought out in the modeling process. And it's really that, more so than any one model, that offers value. It's the doing of the model. Model here is theory building, and what we carry away, even if the model were to be lost in the most horrific of, IT failures, we carry away the most important thing, which is a refinement of our mental models and what we know and what we don't know reliably, what data is really telling us, what the underlying situation is, how to think about behavior more effectively, more accurately in the world. And model can help us better interpret data from the world and what it's really telling us about different areas of the system. And it helps us to reflect on, what we know, what we don't know, our understanding of what's going on. It helps us challenge cherished prejudices and speeds us towards a better understanding. One sooner learns from error than from confusion. One sooner arrives at truth, is what Francis Bacon said, from error than from confusion. He said it in Latin, so those are not his precise words. Now, all of this may be new to you and challenging to you, but I want to use an analogy. I think it's a powerful one, and it's one that goes beyond skin deep. You might think of models as maps. This unfortunate misconstrual of models as crystal balls, or as attempts to perfectly represent the world, has left us with this idea that a model needs to be totally accurate in how it depicts things, or it's fatally flawed. But I'd argue that we deal all the time with imperfections. We deal all the time with purposefully simplified representations of the world. And we need look no further than maps, whether in their physical or virtual form. Maps, like models, represent abstractions of features about the world. When you use Apple Maps or Google Maps, you don't expect it to show the current status of every streetlight, or indeed the location of every streetlight in the city, the width of the sidewalks, or whether there even is a sidewalk. You might not even expect it, depending on which system you use, to show you whether a given highway is divided or not, whether a road is paved with gravel or asphalt. You certainly don't expect it to show, exactly where the sidewalk, the crosswalks are. But it's useful for purposes. This capacity to omit details makes those maps useful. You can quickly glance at it and get the information you may need. But here's the point, and this is, again, where it goes deeper than surface and superficial. Like maps, models are specific to a purpose. So you're going to use a different map if you're trying to decide how to take a bus across your city, or if you want to walk across your city, or if you want to drive across your city. You're going to use a different map. If you're an engineer and you're trying to figure out why there are brownouts occurring in the city, or a civil engineer and you're trying to figure out why there's flooding going on in certain areas of the city, you will use a different type of map. And so what information, and that different type of map means different information is represented that might otherwise be left out in other cases, right? So how we're going to use the map, the purpose for which we put it is used, as John Sermon says, as a logical knife to cut away unnecessary complexity. What details we omit, what things we abstract away from, depends how we wish to use the artifact. What features are germane. And as George Box famously commented, well, all models like map, or well, all models are wrong, some are useful. And indeed, I would sharpen that by saying their very incompleteness is often what is a key factor that allows them to confer value. With this all being said, often because of the emergent behavior of models, the nonlinearity of them, for example, it's difficult to ascertain a priori what information should be neglected, should be omitted from those models. So if we think about the modeling process, we're going to learn in this boot camp that it goes in several forms, or at several stages. And these stages, befitting to a process focused on learning, are iterative. We go back and we go figure. If things don't work out in model calibration, we might change our model formulation. Our thinking it through a qualitative problem level might lead us to formulate a model a certain way, but thinking that through at a sharpened level might lead us to refine our qualitative mapping in a causal diagram, for example, or some variant of that for adapted for agent-based modeling. Our model testing and extreme values and so on might find us that we need to refine our calibration or indeed the formulation. But for all of this, often the most important deliverable is our mental model. It's what we're carrying away in our understanding. Just be aware that the modeling process involves successive stages, but those stages are iterative, as is our learning. So the final thing I want to say here in this set of comments, because I know we are all seeking sustenance, and it concerns the relationship of these sorts of dynamic simulation models and data. And you'll forgive me for sometimes lapsing into vernacular to just say models here. So the view here, if you remember that analogy to Plato's cave, is that reported data from the world doesn't come from heaven. It's not thrown to us like manna in some perfectly digestible form. It emerges from, it's given rise to by an underlying processes of the system, what statisticians refer to as the data generating processes. It doesn't depict in any way a perfect, it doesn't tell us the system state. It whispers to us about some underlying state. And often different data items tell us collectively much more than any one in isolation. They sort of help us triangulate what's going on in the underlying system. And that's how we use them in system science. They're different faces of facets of this underlying system. But that data, those, for example, streams of data, it's not primal. It's contingent. It's subject to change in the data generating process. If we intervene, again, by the pattern of COVID-19, the severity of COVID-19 cases that I see will be profoundly different if I have had a mass vaccination campaign before and after. So all that data I collected on the empirical pattern of, severity of COVID-19 cases, critical, serious, moderate, mild, oligosymptomatic, that would be profoundly different because the data generating process is different once mass vaccination is introduced, right? The fraction of people who pass away in the ICU, indeed, fraction of people who need it might be very different once I introduce remdesivir, for example, a potent antiviral, or once I even change some measure of clinical practice like rotating patients. So look, data is contingent on the underlying system, and we can't build a foundation which assumes that it will be forever present, that it will be forever unchanged, that we do it, owe it our fealty as the true situation. We're bound to be disappointed. More than that, it's coupled, and I referred to this, but those testing numbers and the number of new cases are not solitudes. They influence one, influence the other, here bidirectional, reciprocal relationship. And those relate to the number of hospitalized cases, and those relate to the number of fraction of new cases that test positive, et cetera. These things are coupled. They're not solitudes. And to analyze them in isolation is to miss much of the point for many insights, much of the richness. It's the interconnections, folks. That's what system science is about. It's about the interconnections between things, not the pieces. And if we analyze those pieces in isolation, we do so at our peril. We limit ourselves. We blind ourselves. So distinct sets of data here are different data suits are taken as kind of emerging from different regions of the system, or different levels of summary, and can be valued as such. But they clue us in and they whisper to us consistently about this underlying system. And a given data is recognized as offering information about the drivers that give rise to it in the system. And in fact, collectively, and as we'll see in the system science discussion in this very bootcamp, we have methods from any one data, from picking out information about what's going on across many areas of the system that give rise to it. It's picked up in any one type of measure. They're not just solitudes that each one tells us totally different information. No, they're whispering to us different aspects of the underlying, coupled aspects. And so information in one is overlapped with information in another, etc. We'll learn more. But much model use, much motivation for model use here lies in reasoning about counterfactuals where no data is available. In this enterprise, we don't make our explorations contingent on the data generating process being that has been underway. We're going off-road. We're talking about things that haven't previously been seen. And as such, much of our goals are going to change that data generating process. So the data that we receive from the world, far from being manna from heaven, passed down perfectly, we recognize its limitations, we recognize its partiality, we recognize its measuring from a latent system, but we know it whispers about aspects of that system, and we know it whispers about several different parts of that system often. And systems data science takes all that into account with things like state space reconstruction and use of Taken-Zabetti theory. But here, often our real goal of models, our real criteria of value is not how well does it perfectly match some historic data, but how well does it guide us going forward and asking what if questions and intervening effectively, robustly, cost effectively, and so it yields effects within our expected timeframes, our needed timeframes. So the picture here is of an underlying evolving coupled nonlinear dynamical system. I know it's a mouthful. The world is complex. It's an underlying system that's where different pieces interact and coupled, what someone spreads in terms of infection. Here is a reflection partly of their location. If they're at work, they're connected with other people at work, which ends up changing who they can infect here, etc. Look, I mean, there's these interactions, these causal pathways of various sorts, and they give rise to an evolving system where the different pieces are coupled together, interacting. The world interacts. You can't analyze it as pieces. And measurements that come from this are delayed. They're often non-continuous. They're often incomplete. They're noisy. They may be measured inconsistently over time. And they're often erroneously attributed. We have false positives and we have false negatives, etc. And sometimes they're measured inconsistently over time. And they're contingent. They're contingent on the system. But they induce associations that hold for some periods of time and that are useful to know about. And when we judge our model, often we take that into account and in making sure that it has a first cut reproduction of what we see in the world. But the data is contingent. The data is limited. The data is partial. The data picks up from certain areas of the system and not others. And we are dealing with data that becomes increasingly outdated when we change the data generating process, which we generally do in large part if we undertake any serious intervention. So system science makes use of data, encourages challenging of models through data, encourages collection of data, can help value data, can help us choose, can help us prioritize collection of one type of data by another, help us understand the implications of data in terms of the underlying system, can help us put that data to use in an integrated way with other data items so the model brings together data of many different sorts about natural history of infection, about contact patterns, about people's circulation. But at the end of the day, the model captures structure of positive causal relationships that often considerably outlive the associations seen in emergent patterns from the system, because those associations and the data that gives rise to them are dependent on the data generating process, which is altered when you intervene upon it. So we seek here to build on a stable foundation, to build on rock and not on sand, on something that's more stable. So look, dynamic models allow us to use available data for a high-level insight and to inform decisions, to learn more quickly, effectively, and deeply from that data, recognizing its contingent nature, recognizing it's from parts of the system. And in working with data, dynamic models work closely with and leverage traditional tools. We make use of survival analysis or regression or competing risks analysis, and we'll make use of them in their own terms for as far as they take us on a provisional basis. But we do not hold ourselves hostage to or trust in the perfect character or the complete character or even always the consistency of data. We recognize its contingent nature. We recognize it for its strengths and its limitations. We make use of it, but we are not beholden to it, folks. Okay, so 2 take-home points. Addressing many foremost health challenges, the wicked problems and the complex problems faced by our world, our society. It's especially hard because they exhibit features of complex systems beyond the fact that they span many people, that it's hard to get agreement on certain things, etc. They exhibit recurrent properties. I went through them with a bunch of different cases, just briefly gesturing at it, of nonlinearities, delays, feedbacks, disproportionate impacts of heterogeneity, and quite a few other effects. Dynamic modeling provides us tools to reason about the behavior of these complex systems. It's a science of a whole, complexity science. And it is a science that early on started in its application to physical systems, but has for decades now been applied with great insight. And indeed, for upwards of a century, since 1916, to communicable disease systems in the health and in healthcare areas. Within this context, models express dynamic hypotheses about processes underlying the observed behavior that we posit to underlying this behavior, not because we feel we owe them a recognition that that is the truth, because we know by representing it explicitly in a shared way, we can get the insights of others to bear. We can get our understanding improved, get it challenged. We can compare our understanding to others. We can build on the insights of others. We can have it critiqued, undercut, falsified, etc., by representing it explicitly rather than in our head. And models here are tools that help us understand, help us build some understanding more reliable than thinking in our head of what's going on in the world, why we see observed patterns, and how interventions might affect things. They can help us better understand the degree to which those rising case counts are a failure in terms of infection control or a success in terms of case finding. They're specific to purpose. I argued from this seat that models like maps inevitably involve, but more than that, secure value because they abstract away from many details in the world. But what they abstract away from is specific to their purpose. Just like a map, we look to a different thing to abstract away, and we look for different details to be ignored or to be captured by a map of that helps us take the bus across the city, or subway if you have one, or to walk across the city, or to bike across the city, or to drive across the city. And indeed, a very different map than if you're trying to figure out why flooding occurs in different areas of the city. Our maps that we use are all wrong in the sense of George Bush. What am I saying? George Box, sorry. But they're specific to purpose. What details they show is specific to how we're going to use them, what we're seeking to get out of it. Multiple and hybrid modeling types are complementary. This is not a matter of, agent-based modeling rules them all, although you'll hear rumblings of that in certain quarters, which I consider uneducated, and oversimplified and self-serving. But they're complementary for describing different types of modeling, hybrid modeling, as we'll see, and system dynamics tools like stock and flow modeling for simulation, discrete event simulation, agent-based modeling are very powerful for describing complex, for helping us deal with complex decision-making challenges. They have different areas of strength where each offers particular strengths or certain weaknesses. And we will be discussing those, but it's not a matter of either or. It's a matter of where we use each to good effect. Models help us understand patterns in data and how those patterns could change given intervention, given changes in the ambient situation, the occurrence of an economic downturn, the arisal of tariffs. Funny you mentioned that. The introduction of a new vaccine or of a therapeutic intervention, or changes in people's behavior induced by social media or what have you. It's not so much the models, but the modeling that offers the greatest value. Models are valuable. Modeling is more valuable. Modeling helps us understand from each other, helps us bring together diverse viewpoints and sort through them, helps us realize differences in viewpoint that were never previously recognized, helps us better understand the empirical data sources available, their strengths, limitations, their omissions, what they do pick up reliably. Modeling helps us identify inconsistencies in those data sources over time. Modeling helps us think more clearly, more deeply, more thoroughly, more quickly through the implications of our actions. Helps us learn more quickly, more thoroughly, more deeply, and more quickly about how to interpret empirical data. It's the modeling, not the model. It's our improvements in our mental model, our savviness on what to count on, what not to, how to interpret things, or caution and interpret things a certain way. It's about our ability to limit our exposure to our personal and cherished prejudices concerning the situation, and to check our understanding against the reality by holding it up against the crucible of evidence and by testing the consistency of our hypothesis against what we see from the world, what we hear from people, system stakeholders, and people with lived experience who are experience on the ground. So models are not the truth, but they help speed us to the truth. And finally, I'll make a point. It needs to be made. If not modeling, what? What's the alternative? Is the alternative to rely on our mental models, inchoate though they are? Is the alternative to turn to associational models, where those associations are based on data generating processes that will inevitably change based on interventions or ambient changes in the world? To data generating processes which treat each data source as a solitude, when in fact they are coming from a common underlying process? Is the alternative to put our faith in opaque deep learning models, which are not trained to reason causally, and where we assume that the associations will carry through upon intervention, confusing causation and correlation? Is it to offload our reasoning about the world, the clarity of our mental models, to an external source and simply trust that although it's trained based on the extraordinarily contingent nature of data collection, the data generating process, that will continue to offer value long after those patterns in the world have been altered, and altered profoundly sometimes? I would argue, like Winston Churchill about democracy, that dynamic model is the worst of all alternatives for improving our understanding and the efficacy, cost effectiveness of our actions in the world. The worst of all ways, except for everything else I know. Winston Churchill, of course, said that about democracy. It's the worst of all forms of government. Worst of all forms of government, except for everything else. And so it is, I feel, about dynamic modeling and about agent-based modeling as a particularly powerful example of that. it may be the least bad of the known alternatives for many goals, for many types of reasoning and deliberation and action. And the truth is, it is best used with and to greatest effect. It can be used together with some of these innovations, the growth of big data, the availability of machine learning techniques, provide wonderful opportunities for synergy when we use them savvily and not simply trust them as oracles to give answers. We can use them to profound effect together with dynamic modeling. And it's to that goal that I will devote unusually some of this boot camp based on the requests coming from you, dear participants. So I will stop my comments here now, stop my prepared remarks. I would certainly welcome questions, statements, comments, and others.